Medical Revalidation of Puerto Rico, Clinical Vignette on Tetracyclines and Photosensitivity. Clinical Vignette. A 25-year-old woman presents to the clinic with a painful red rash on her arms and face after spending the weekend at the beach. She reports that she applied sunscreen, SPF 30, in the morning, but did not reapply it throughout the day. She denies any history of sun allergies, but mentions that she recently started taking doxycycline for acne. On examination, she has erythematous patches with mild blistering on sun-exposed areas, sparing covered regions. Question: which of the following is the most likely cause of this patient's symptoms? A. Polymorphic light eruption. B. Doxycycline-induced photosensitivity. C. Systemic lupus erythematosus, SLE. D. Pellagra, niacin deficiency. Correct answer B. Doxycycline-induced photosensitivity. Explanation: this patient developed photosensitivity dermatitis, which is a well-known adverse effect of tetracyclines, especially doxycycline and dimeclocycline. Key features of tetracycline-induced photosensitivity. Sun-exposed areas affected: face, arms, hands, legs, erythema, burning sensation, and in severe cases, blistering, onset within hours to days of sun exposure. History of tetracycline use, e.g. doxycycline for acne, Lyme disease, or respiratory infections. Pathophysiology: tetracyclines absorb UV light, leading to reactive oxygen species formation, which causes cellular damage and skin inflammation. Prevention and management: avoid direct sun exposure. Use broad-spectrum sunscreen, UVA, UVB, and reapply frequently. Wear protective clothing, hats, long sleeves. Consider alternative antibiotics, e.g. azithromycin if prolonged therapy needed. Why not the other options? A. Polymorphic light eruption. Occurs in people without a history of medication use. Lesions are more pruritic than painful and typically resolve without peeling blistering. C. Systemic lupus erythematosus, SLE. Malar rash in SLE is butterfly-shaped, spares the nasolabial folds, and is associated with joint pain, fatigue, and systemic symptoms. No history of autoimmune symptoms in this patient. D. Pellagra, niacin deficiency, presents with the 3 Ds: dermatitis, diarrhea, dementia. Rash is bilateral, symmetric, hyperpigmented, and worsens with sun exposure but typically appears on the neck, cassal necklace, and extremities. Key takeaways for medical revalidation of Puerto Rico. Tetracyclines, especially doxycycline, cause photosensitivity. Patients should avoid prolonged sun exposure and use protective measures. Alternative antibiotics should be considered for patients with high sun exposure risk.